Unfortunately, many people have what we call this hypersensitivity, or they're atopic. So they have sort of this all-out hypersensitivity response to things that aren't worms, right? And it is a major problem. Some of them, of course, if the allergens get into the blood, we can get anaphylaxis and death. A lot of the times, though, they just make people really, really miserable, right? If we get rhinitis or if we're allergic to different foods. So it's you know, lots of money every year spent on treating allergies. All right, so I'm going to split this in half. All right, so we're going to talk about the sensitization, right? And then, of course, this is re-exposure on the right. So we're first going to talk about sensitization. So remember, the first time we get exposed, we don't have a response. But this is when the immune system is really sort of turning its back on us, okay? So what's happening is we inhale, let's say, pollen. We get a very strong Th2 response, which mediates class switching to IgE, okay? Now, as you can see here, we're going to start making IgE, which has a pretty short half-life in the serum. But once that IgE binds to Fc receptors on the surface of mast cells or basophils, it can stay there for months to even years, okay? Now, the one thing I want you to notice about that IgE that's on the surface of that mast cell is that the FAB fragment, the region that binds to the antigen, is still, remember this guy, right, is still open. It's bound by its Fc receptor, okay? So it's just sitting on the surface of the mast cell or basophil. That's like a loaded gun, okay? So that's why you have the immediate nature of this reaction, the sound. All right, so this mast cell or basophil can hold that IgE for a long period of time. Then we get re-exposure to the same allergen. Remember, it's still an immune response, still has to be specific. And what happens, and I don't have two of these, so I can't show you very well, but if these were two separate antibodies, we could get cross-linking, right, of those antibody molecules like you can see here. And that cross-linking of IgE on the surface results in degranulation, and we know that happens pretty fast, right? We all have friends, and maybe it's you that has the allergy, but you know when you get around your trigger, whether it's, you know, somebody's cat or dog or dust or whatever it is, that reaction happens very, very quickly. So within a few minutes, you start to feel the effects. So that's why, you know, we have this immediate nature of this reaction. So now that we sort of understand, you know, the mechanism here, we're going to get into a little bit more detail about these mediators that are sort of making us miserable, okay? So what are the effector cells here? We know mast cells and basophils, of course, those are the primary effector cells. Those are the ones we're going to see the effects of right away, okay? Eosinophils, though, are going to get recruited, so they're not going to be reacting right away, okay? It is because of components released by the mast cells and basophils that recruit and activate the eosinophils, okay? So eosinophils are going to come a little bit later. All right. Immediately, of course, you guys know histamine and other things, but histamine is sort of the primary mediator within the granule that gets released. And we see some of those effects early, but later on, we see the result of the secondary mediators, which are the prostaglandins and leukotrienes. And the reason we don't see those until later is because the prostaglandins and leukotrienes are not made and pre-stored in the granule, right? So once you get cross-linking of those IgEs on the surface, right? Because typically, so hopefully this will answer your question, because typically those antigens are multimeric. So yes, they would have to bind two separate IgE molecules for them to cross-link. But then phospholipids in that mast cell membrane or basophil membrane break down into the arachidonic acid pathway and produce prostaglandins and leukotrienes. But that is not available immediately, all right? So those things are late phase reaction. And, you know, they may be late to the party, but they make their presence known. So the prostaglandins and leukotrienes have a lot of the same effects as histamine, but they're more potent and they last longer than histamine. Okay. This is probably one of my favorite slides because it really is good at sort of showing what some of the systemic effects are when you get degranulation, right? So histamine, and we've sort of mentioned this already, we know histamine is an inflammatory mediator. It causes vasodilation, increased vascular permeability, right? So all of that in an inflammatory response that we need is a good thing. But all of that in an inflammatory response that we sort of don't need just causes us a lot of issues, right? So we get the vascular leakage, we get the swelling in the respiratory tract, the bronchoconstriction, in the GI tract. We can see lots of increased peristalsis. So we have a lot of discomfort and potentially diarrhea, right? But these guys are mediators of inflammation. And in the absence of an infection, right, if there's no infection to sort of take care of, and it's really legit just a piece of pollen, then we are going to start to see tissue damage, especially in chronic diseases like asthma. That tissue damage can be pretty severe, okay? During this degranulation process, we recruit our friend over here, the eosinophil. And the eosinophil, when it becomes activated, will degranulate and kill these little worms, which is great because we don't want them, okay? But also, just like over here, begin to cause some pretty significant tissue damage if there's no parasite, right, to get rid of. So we're having this all-out immune response that was meant to kill some sort of a helminth or a worm that is getting activated and then having a pretty dramatic effect on the tissue, okay? Of course, your primary mediator, we talked about histamine. When we talk about the boom, the immediate nature of the type 1 reaction, that's the result of histamine because it's pre-stored in the granules, it gets released, and we feel the effects right away, okay? Eosinophil chemotactic factor. We said eosinophils aren't a problem right away, but there are things that are made and pre-stored in the granules that are going to recruit eosinophils to the area, and that's one of them. And there are cytokines and other things in there as well. Our secondary mediators, the ones that comprise the late phase reaction, those are the prostaglandins and leukotrienes. Again, similar effect to histamine, but more potent and last longer. And again, recall leukotriene B4 as a major chemotactic molecule, right? Just to review really quickly, because it's been a while, chemotaxis, leukotriene B4, IL-8, C5a. Those are major chemotactic molecules. Okay. This is just sort of an overview of some of the type 1 diseases. Allergic rhinitis is mostly in the upper airways, so typically not a major problem, but when it's in the respiratory tract itself, in asthma can be a major problem, because we definitely get airway remodeling, we get deformation of mucus plugs, and during that bronchoconstriction, I mean, there is just literally no way that air can be exchanged because of the narrowing of, you know, those structures. Now, systemic anaphylactic Hirschman spirals are basically from the dead cells that form, you know, in this massive immune response and all the excess mucus. Definitely for pathology, super important. All right, systemic anaphylaxis, when we get this massive sort of type 1 reaction in the blood. So get massive vasodilation, increased vascular permeability, so the fluid's leaking out, the heart has to work harder to pump. You can go into organ failure. Usually you die from bronchoconstriction before that happens, but it's an emergency, and people usually carry an EpiPen. We don't even have time to discuss what happened with that last year, but that was a disaster, right? So they like bumped the price of the EpiPen in like ridiculous amounts, right? It was horrible. But anyways, so those are some of the type 1 diseases potentially that they could ask you about, right?